Do you find yourself struggling with unpredictable periods in PCOS and wondering what's going wrong? You're not alone. Today, we are diving deep into what normal physiology of ovulation and menstrual cycle is, how PCOS affects your menstrual cycle, and actionable strategies that can help you regulate your periods naturally and with medications. So stay tuned to discover how you can take control of your health and achieve a more balanced cycle. Welcome to PCOS Mindset Coach podcast, where we explore ways to accelerate towards your PCOS goals. I'm Dr. Rashmi. I'm a physician, an OBGYN physician, and a life coach who specializes in helping women with PCOS manage their minds so they can optimize their health and well-being goals. As both a physician and a life coach, I bring a unique combination of medical knowledge and coaching skills to help women with PCOS manage their health. PCOS can affect every part of our life, from our physical health to our emotional well-being. And one of the biggest challenges with PCOS is dealing with irregular periods, which can throw your body and mind off balance. So to help you better manage your PCOS and regulate your periods, I want you to first understand what's actually going on in your body, like what's happening at the physiology level. Like as a doctor, that was the first subject we had learned, physiology, in our first year of medicine, where they teach us like exactly nitty-gritties of all of the body functions. And menstrual cycle and ovulation cycle was really complicated. Many people used to like get really psyched up about it purely because it was so complicated. But I want to explain to you in like a simpler language, because I have done that as a doctor so many times. I've explained it to my patients, so I hope this is useful for you. By the way, in case you want to keep hearing this sort of information often, please subscribe to my channel. If you're listening to this on Spotify or Apple Podcasts, please give me a rating and share it with someone you love. Okay, so let's talk about what happens during a normal menstrual cycle. Now, understand one thing. The whole process of having menstruation periods, is to prepare you as a woman to have an ability to have a baby every month. Yeah. So that ability starts at the age of 12, 13. And if you had an earlier period, like 8, 9, that's where your body started it. So we are actually ready to make an egg. So anytime a girl has sexual relationships that time or gets raped or something, she can still get pregnant at that age. But that's when the ovulation and the hormonal cycle starts. Since then, your ability to get pregnant starts then. Now, in a typical menstrual cycle, your body goes through several stages that prepares it for a possible pregnancy. So this is the endometrial lining, or the lining of your womb. These are the two hormones. This is progesterone hormone and estrogen hormone. This is the ovulation mechanism in your ovaries, and this is FSH, LH hormones. So what happens is, these are the changes which are happening throughout the month. It's like a very fine-tuned process. As I said, even as a doctor, it was challenging for many of us to understand. But I'm going to try to explain. If you get overwhelmed, please come back, okay? Because don't just dismiss this video, because I'm teaching something scientific, but I want you to know this purely because once you understand this, it will be so much easier for you to sort of like regulate your problems. So our menstrual cycle, normal periods need to be 28 days. Sometimes 26, 30 days is acceptable, but they need to be regular. So anyone who's having 28-day cycle, they are making an egg every 14th day, right? So that's when the egg is released. But the uterus is a bag which is supposed to hold the baby, and the egg or the ovaries is the one which is making the egg. So for you to make a baby, we need to have this monthly egg, and once the baby, like the sperm meets the egg, it will come and stick on the uterus, because this bed is getting ready for the baby to hold the baby. When the baby doesn't come at the end of the 28 days, it crashes and you get your period, right? So menstruation, first half, that is first 1 to 14 days, that is the first phase of your cycle, which is the follicular phase. Here in the beginning you will have menstruation, because both your hormones have come down, estrogen, progesterone, FSH, LH, all of these hormones are like very low in the beginning of your cycle, which sort of like crashes the endometrial lining. It removes all the hormonal support and you start to bleed. So you bleed, and then the endometrial lining starts rising again, right? So during this time, we have millions of eggs in our ovaries. Around 10-15 eggs get recruited, or maybe 25 also. So they all will start growing slowly under the influence of FSH, which is the follicular stimulating hormone. They will start to grow. Now, of the 10-15 eggs which have started to grow, only one will be a dominant follicle, which will reach here. Others will will die. So the one which becomes big is going to rupture by this time. Now, for it to rupture, we need to have this LH surge. So in the follicular phase, this is building up the endometrial lining, the uterus lining to hold the baby, and this egg is maturing inside to, have a potential to mix with the sperm. Now during ovulation, 14th day, your hormones are rising, especially estrogen. FSH spikes a little bit and LH spikes a little bit, luteinizing hormone, and that produces ovulation, right? So this egg is going to live only for 24 hours. So if you have sex around this window, you will get pregnant. The chances the baby will be formed and it will come to stick over here, because the baby forms in the tube and then it will come and stick in the uterus, the womb, on this lining, right? Now let's come to the second half of your menstrual cycle. This is the secretory phase, where what happens is this lining continues to grow, waiting for the baby. So even if the baby forms, like say around 14-15 day of your cycle, it takes another 5-6 days for it to come from the tube into the uterus and implant over here by day 21. So by that time the bed is like really nice and chubby and thick, so it can like stick on it. And if there is a pregnancy, this progesterone hormone, this line will just keep rising. Both hormones will be just high. But suppose if there is no baby that time, then what happens is this egg which was released, it shrinks and becomes a corpus luteum. So when you're pregnant, corpus luteum releases progesterone, which will support the baby. And if there is no baby, then this thing shrivels. This lining keeps waiting till 28th day. All the hormones drop. The body comes to know that there is no baby. So the lining sheds, and then again we start the next month, the same cycle. Now, what happens in PCOS? In PCOS, because of the high insulin, first there is insulin resistance. That is either you get it from your mom or your family, because of the familial diabetes sort of tendency, diabetes, obesity, hypertension. Either you get it from that, or you just like start consuming a lot of refined carbohydrates because of the stress. That refined carbohydrate causes so much high insulin because of carbohydrate. That insulin is just going to be high, and then all your cells start becoming resistant to it. So ovaries start becoming resistant. So that causes insulin resistance. Now what it does is it disrupts the normal egg development. Remember this delicate cycle? This gets disrupted and there is no ovulation, because there is this LH hormone. Along with insulin resistance, there is LH resistance. So the LH becomes little high, luteinizing hormone. The hormone which is supposed to make the egg is high from the beginning. It does not spike like this. So remember the 10-15 follicles I said, they start like, they get recruited to make a dominant follicle, like they are in a race who's going to be the dominant follicle. They all get stuck in this sort of stage where they don't become dominant, but they become big, and they all get stuck in that stage, as a result of which they give you that polycystic appearance of the ovaries. Also, what happens is there is raised androgen because of that luteinizing hormone. There is elevated androgen, and which causes again the eggs cannot form. Also, the ovarian stroma, which is like the ovarian tissue, becomes thick because of this androgen, as a result of which the ovaries look big, bulky, and polycystic. So that's what is happening with the PCOS picture. With the insulin resistance and the high androgens, that's what is happening. Then there is this imbalance of FSH LH. There is no ovulation. Every month you don't make this egg. Unfortunately, what happens is, like, even if you're not trying to get pregnant, this lining gets messed up, because in polycystic ovaries there is no progesterone. So this protective progesterone which is to come to chubby it up, that disappears. As a result of it, this lining just keeps on growing, and then once it becomes very big after some time, then it crashes. So there will be irregular periods. Sometimes there will be no periods. And as a result of it, what happens is, like, you just have like an uncontrolled estrogen exposure on many of your organs, like your breast, on your uterus, because in breast you will get lumps, and then in uterus you might get fibroids, you might get polyps, and all those sort of issues can happen. So what we doctors do is, when you're not having period for a long time, we give you a little progesterone. You know, those pills that you have received like for 5 days, those are progesterone pills, which sort of like expose your body naturally. Like, you know, naturally that progesterone will come and then it will disappear and then the period will come. So we try to mimic that by giving you progesterone from outside, and then give it for like 5 days or so, and then stop, and then see if the bleeding comes. And it comes, right? Because that's not a problem for you. Uterus is not a problem for you. There are some patients who will not get bleeding, but that's another complicated issue, not PCOS. So that's what doctors do. We try to mimic some hormonal things. Now, elevated estrogen and almost absent progesterone in PCOS can cause a lot of water retention. Water retention all over your body, which generates that heaviness, swelling on your face, on your arms, like everything is like stiff. Like many of my patients tell me about that. Many of my clients tell me about that. Apart from that, they also develop something called as gaseous bloating, which is like, it's because of the hormonal imbalance again, because we need that delicate balance of estrogen and progesterone on our gut intestines, right? Now, when you have so much estrogen and no progesterone, the gut or the intestinal tract slows down. So there's reduced motility, because of which the gases will accumulate. Also, the digestion process, the fermentation process of the foods that we eat, especially if carbohydrate rich foods, again the gases are too much, and then you don't understand, like, why is this happening to me? Like, why am I so bloated? Why does it hurt? Why does it feel so heavy? And it's because, and you will start feeling better the moment you get your periods, because that whole built up has come down. So all of these hormonal imbalances directly impact your daily quality of life and might directly affect your self-confidence at work to do brave, courageous things, or get you short with your family members, with your spouses, because you're like so messed up in the head, like so annoyed with all these things which are going on with you. You might have more fights. You might even, like, I know of clients who are reaching divorce because of this inability to control her mind around this condition. There are some of my clients would struggle with time, like they will perpetually be late and fear getting fired. So many of them will just like be scared to like show up, like even when her brain knows so much, right? Like, I can do this, I can do that, like at work, but she still can't show up because of these issues, because of body image issues, because of all these hormonal imbalances that she's struggling with. And overall, not knowing how to cope with it, because the way most PCOS women land up coping with all this imbalance is, instead of like figuring out what went wrong, what they do is like they just go and eat some more carbohydrate rich food because that actually suits them in the moment, but eventually backfires. Or they land up like shopping a lot of non-specific things just to feel better, right? Even when they have plenty of clothes, they will think that they have no clothes. They will just keep on buying small things to get that dopamine pleasure. or they might keep changing jobs, or they might just like keep on staying awake at night on the phone, scrolling constantly, watching content aimlessly without focusing on her lifestyle, on her sleep, on her exercise, and all of these amazing things. The brain will be focused on these other areas. So, to summarize, one thing that has actually flipped all this hormonal imbalance in PCOS women is insulin resistance. Now, if you got it from your family, there is nothing much you can do about it, right? Like, you just have it. And even if you just have it, you can correct your lifestyle. You can correct the way you eat, the way you sleep, the way you manage your mind, the way you exercise. All of that is possible, right? So if we correct, because those things which I mentioned, sleep, food, exercise, and mind, if you take care of these 4 things, your insulin resistance comes down. Because you are going to take action, like eat foods which are like not going to worsen your insulin resistance. You're going to like move a little bit, which will again improve insulin resistance. Or like just manage your mind so that your stress comes down. So if we correct these lifestyle factors, we actually reduce your insulin resistance. We become insulin sensitive. We reduce your androgens, the sex hormones, the male sex hormone, which is like slightly high in PCOS. We might reduce LH. Yes, my friend, that's the beauty of, like, I've seen patients with just little bit weight loss or like little bit correction, their luteinizing hormone comes back to normal and their ovulation resumes. They get pregnant naturally if you're trying to have a baby. If you're not trying to have a baby, your periods become regular, pain is lesser, bleeding is lesser. So much improvement is seen once the lifestyle change is happening. So we want to focus on bringing back your ovulation, especially if you're young, so that the periods regulate. Now, how can lifestyle change help normalize your cycle? So somebody asked me that, like, please give us practical tips to like naturally correct your periods. And as I said, you need to make it, sorry, I am on this track where, okay, anyway. So we need to, okay, since I told you, I'll tell you. There is this jar where I give myself a reward every 10 minutes when I do focused work, right, as planned. So I have already collected these many since morning, and it's like just 10:30 a.m. So every 10 minutes I've like worked so much so far. So it's like, yay. So I have client sessions today, but I have a goal of like getting 28 of these marbles before I start coaching my clients. So I'm like on the go. I think I got one more while I was making that presentation, so I'm just gonna give one more. Okay, coming back to like what are the lifestyle changes that can be used to normalize your cycle naturally. Now, see, I will talk about medicines later, but the goal is to improve insulin resistance. And how we do that, we need to focus on food. You need to clean up your food. Like so many of us think, so many of my clients tell me that she eats healthy. Like she really believes that she eats healthy. Unfortunately, when we start working together, I ask them to like share with me in a spreadsheet everything that she has eaten throughout the week. So she does a real-time data entry in a spreadsheet, which I will see with her on our coaching call every week. And we see that she is eating a lot of foods which are actually worsening her PCOS, is worsening her insulin resistance. Like the other day, I had a client who was gluten-free, and she was having a lot of gluten-free foods which she thought were healthy because she was taking care of that gluten issue, but it's all flour-based refined foods, which is worsening her PCOS. So eating whole foods, more of fruits and vegetables, lesser refined carbohydrates, or having whole grains, not refined grains, and focusing more on low carb foods like proteins, natural proteins, or natural good fats. This will actually help your body use insulin better, the way it was designed to. It will reduce the high insulin and lower your androgen production. Now, those of my clients who want to lose weight, I ask them to go very much low carb and slightly high fat. and moderate protein, because we want to go into ketosis. For weight loss to happen, we need to go into ketosis. Once you reach the weight loss goal, then you don't need to be in ketosis. There are many people who think that you can just always use ketone bodies as energy source instead of glucose. I don't believe that. I think a lot of carbohydrates have a lot of vitamins, minerals, fiber, bulk, which is important to have like a regular bowel movement and just regular well-being. I personally don't like to take supplements, so I want to include my carbohydrates. I have nothing against carbohydrates, but examining the way you're eating is very different, right? Like, it's different from client to client, woman to woman. So do not compare yourself with any other PCOS woman. If you really want to examine how you eat, you need to come and get work with me, because I really micromanage how you're eating, and we like try to explore, like, okay, when the plan was this, why did you eat this? This issue happened. Okay, this was an out of plan food. Why did you eat that? What was the emotional problem behind it, which your brain sort of unconsciously coped with food? So we do that sort of work in my coaching practice. So it's important that you examine the food that you're eating. This will really, once your brain comes to know something, it catches something like, oh, I didn't even realize this was happening, it's not going to let you do it again. And sometimes it still does it, like we have the awareness. So there are other coaching tools that I have that I can help you with, but it's important to look into your food. Even like losing a little bit weight, like even if you think like you are irregular periods and you're slightly overweight, losing a few kilos might really lower your insulin and androgens and help you regulate your cycles. So apart from food, there is also regular exercise. Improving insulin sensitivity with regular exercise can be really helpful with regular ovulation and just like overall hormonal health, because exercise is known to bring down insulin resistance. Now I have another episode on exercise, so please, I will tag it here in this episode about exercising. Have a listen to that if you struggle with exercise. Apart from that, drinking enough water, at least 2 to 3 liters a day, not more than that. There's something called as water intoxication, but just like at least 2 to 3 liters a day, it will help you flush out all those gases which is causing you bloating, and also might take care of your emotional hunger and cravings which are coming from eating all that processed carbohydrates. Apart from that, sometimes dehydration can cause cerebral edema, which is like swelling of your brain, which can produce irritation and like being snappy. So like just drinking at least 2 to 3 liters of water can sort that issue out. Next is stress management. This is crucial because stress is caused by your thinking, and when you are in stress, your body has more cortisol, which is your stress hormone. This stress hormone worsens insulin resistance. So it's so crucial to bring down that emotional stress. So we do that like we do that with regular mindfulness practices, meditation, and cognitive behavior therapy, which can help reduce cortisol levels, balancing your hormones, and making your periods regular. I have another series on reducing your cortisol or stress. I will tag that as well here. Now, also regularly focusing on your mind-body connection. Now, as a life coach, I use cognitive behavior therapy to help you manage stress, anxiety, and negative thoughts that can disrupt your hormones. By improving your mental well-being, you can help restore regularity to your menstrual cycle. So cognitive behavior therapy is one of the avenues which so many PCOS coaches are not even looking into. They're not even trained into it. So if you are someone who has tried dietitians, who has tried weight loss coaches, or like has tried fitness instructors, but still revert back to your old way of eating, you have to try cognitive behavior therapy, because we try to solve the root cause of your problem. Now, apart from that, medical treatments. Listen, if you need medicines, you need medicines. There's nothing much you can do about it, especially if you're bleeding like crazy, or you're just not getting any periods, or you're trying to have a baby and it's not working out. So hormonal contraceptives, birth control pills can help you balance your hormones and lead to more regular periods. Understand, they directly just give you estrogen and progesterone. So your endometrial lining will regularly shed. So that's, if you are someone who wants that every month period on time, birth control pills will help you achieve it. But they are hormones, that too sex hormones or steroid based hormones, so they will have side effects. You can't take them for a really long time. So it's okay to take it for some time, as a contraception for some limited amount of time, but you can't take this for the rest of your life, because PCOS is a chronic problem. You can't keep taking these pills for the rest of your life. It's not even recommended that way. There are some OBGYN doctors who would give you specific birth control pills to reduce facial hair, and they really see improvement with it. But again, you can't take it for the rest of your life. Even when I know of patients who take it for the rest of their life, it's not recommended. Don't do that. Then there is metformin, right? Metformin actually improves insulin sensitivity. It reduces insulin resistance. And then again, all the correction that happens with insulin resistance improvement. Now, but with metformin, again, it's a tablet. It's a medicine, and it has side effects, and sometimes it stops working. It doesn't work after a point. If you especially are not correcting the way you eat and drink and move, it's going to stop working after a point. Then there is progesterone therapy, where you just, like, instead of giving estrogen progesterone pills, which is your birth control pills, we just give like progesterone pills like Devry or norethistrone, what is called Primulate N, or Dufaston, which will just basically induce a period if you're not ovulating regularly, helping you manage your uterine lining and prevent further complications. It is recommended that PCOS women need to have at least 4 periods in a year, so that she doesn't have that uncontrolled estrogen exposure on her uterus. So because otherwise there will be polyps, or there would be fibroids, and your risk of getting endometrial cancer might increase too. So apart from that, there is medical treatment for ovulation induction, where you can take that medicine to make an egg naturally, so that you sort of skip the whole natural hormonal cycle without doing all the hard work. But understand one thing, that there's a reason why your ovulation has stopped, is because the brain thinks that it's not safe for the baby, right? The whole purpose of ovulation is to make a baby. The whole purpose of menstrual cycle is to make a baby, and if it's stopped, there is a reason, there is something wrong. Now, if I give you, as a doctor, give you ovulation induction without you correcting these causes, I'm like literally putting your baby at risk and you at risk, because you will have complications. And that's what is happening in our day-to-day life. Doctors are giving these medications. I don't ethically feel it's right. That's why I don't work as a physician in clinical practice. So that's why I'm here helping you out with correcting your PCOS, bringing down your insulin resistance before you get pregnant, or even it might help you get pregnant naturally as well. So those are the medical treatments. Now coming to supplements. I'm not a personal fan of supplements, as I hate swallowing pills. In general, I hate their smell. I hate the side effects that they produce. So I personally never took any outside of my pregnancy. And I always focused on consuming foods that are rich in vitamins and minerals, or lifestyle changes that would improve my insulin resistance or vitamin D. But if you are someone who loves and enjoys taking supplements, who enjoys the process of it, then following might help. There is inositol. This is a new one. It's a supplement that can improve your body, how your body uses insulin, reduces androgen level, and promotes ovulation. Just basically improves insulin resistance. Apart from that, vitamin D, if you're deficient, that might definitely help. And omega-3 fatty acids. These can help you reduce the inflammation and support the hormonal balance, making your periods more and more regular. Lastly, the thing that you can try is cognitive behavior therapy. Now, through cognitive behavior therapy, we help you spot and change negative thoughts that cause you stress. This stress is a problem because, first of all, it's worsening your cortisol and then insulin resistance, but it's also making you form habits like eating refined carbs to cope with it, or skipping exercising, or feeling overwhelmed, it's it's making you do all the things, all the wrong things, instead of like taking care of your body. So by shifting your mindset, there is something that you're thinking which is producing the stress. So cognitive behavior therapy helps you find out what are you thinking which is producing so stress. Take care of that first. At the same time, working on a goal, one goal at a time, focusing on, like, suppose if you want to exercise every day, focusing on that habit every day, no matter what. Or like you want to clean up the way you eat, you want to lose weight, focusing on those habits one at a time, you can make these healthy changes feel easier and natural, provided your thinking is in place. You need to think something which is motivating, which is like cleaner, instead of like, oh, this bad thing might happen, that bad thing might happen, let me just like go and revert back to do things which the way they were. And it, like, and the worst part is like you don't even realize like why is this happening, right? Because most of us would feel helpless. Like we want to lose weight, we want to eat healthy, but we still see like why is this happening? The reason why it's happening is because you have unconscious thought patterns which are making you do that. We just need to catch them, reason with them, and form new thought patterns which can help you create a better behavior which is PCOS friendly. So it might seem challenging at first to do all these things, but with the right support, exploring this approach can give you a better and lasting handle on managing PCOS and balancing your hormones. So together with a coach, we can set realistic health goals, take positive steps to reinforce healthy habits, help you restore your ovulation and in your cycles. So managing PCOS and regulating your periods doesn't really have to be overwhelming. By understanding what's happening in your body and making some key lifestyle changes, you can take control of your health and work towards more regular periods. Now, as a physician and a life coach, I'm here to support you in every step, all the way. By combining a balanced diet, regular exercise, stress management, and targeted medical treatment if required, or targeted mindset management, you can bring your body back to balance and achieve your health goals. And if you're someone who has not used this but are curious about it, please get in touch with me and we can like get you started in my coaching program. So thank you for listening to me today on this podcast, PCOS Metabolic Coach, PCOS Mindset Coach. It used to be Metabolic Coach before. I hope this episode gave you some valuable insights into how you can regulate your periods. If you are dealing with PCOS, remember, managing PCOS is a journey, but with the right information and support, you can take control of your health and reach your goals. If you found this episode helpful, please subscribe. Rate on this podcast if you are listening to my Spotify podcast, and share it with others who might benefit with it. I would love to hear from you. Feel free to reach out with any questions or topics you like to hear more about. As always, I'm here to support you in every step of your health journey. Until next time, take care and stay healthy. Bye.